Hello dear students and esteemed learners. Welcome to my course on Sociology of Health. This is beginning of the third week and the theme that we have included for this third week is medical pluralism and health behavior. Now in the second week we covered a theme on understanding the theoretical perspectives, and there we included several perspectives like biomedical perspective and then the major sociological and anthropological perspective like functionalist perspective, Marxist perspective, then symbolic interactionist perspective, and then cross-cultural perspective also, etc. Now in this third week we have identified a broader theme, that is medical pluralism and health behavior. Now, you might have noticed in your surrounding that there are different systems of medicine, there are different practitioners of medicine. Although very often you may find that is dominated by the practitioners of biomedicine, which is also identified as Western medicine or modern allopathic medicine, but simultaneously we also have the presence of many traditional medicine practitioners like Ayurveda or Unani or Siddha, homeopath, etc. So there are so many things happening within the domain of healthcare. The theoretical perspectives helped us to understand the growth of the modern healthcare institutions in 20th century, and this larger theme on medical pluralism and health behavior will help us to understand how different systems of medicine developed in last 100 or 200 years, and to what extent each of these system of medicine change the health behavior of people or health seeking behavior of people, or how did all of those systems of medicine collectively change the health behavior of the people. And so this broader theme is very important. Now let me add here that this topic is actually complex because in last 200 years there were so many scientific inventions and then so many approaches which emerged around the idea of medicine and healthcare that often it becomes difficult to understand each of them separately within a short period of time. There are courses on history of modern medicine, and that can be a separate course which basically try to identify the growth and the changes taking place within each of those medicines, but that is a very extensive course. So in few lectures I have tried to understand the major changes which took place, the major developments which took place. But one thing which is very interesting sociologically is this, that when we have this modern system of medicine, then what kind of impact it created on the traditional systems of medicine. Because in sociology we understand that modernity often replaces traditions, but that is not the larger discourse visible here. What we are witnessing is this, that the modern allopathic system of medicine is becoming more popular, and along with that the traditional systems of medicine which are also identified as alternative system of medicine or complementary system of medicine, these are also becoming popular. During the last pandemic, that is the COVID, we all have witnessed that how several traditional systems of medicine were becoming very popular. That means all these systems of medicine are becoming popular and these are finding acceptance among people, although in different contexts. So, for understanding the kind of changes which are taking place within this and how these influence the social behavior of people or the cultural behavior of people or what is happening in the social and cultural domain because of these developments, it would be pertinent to understand that what kind of important facts is available and what kind of understanding is already available so that we can take support from these things to understand the rest of the topics included in this course. So, with that broader perspective, I have included all 5 lectures of this third week within this broader theme of medical pluralism and health behavior, and we will try to understand all major systems of medicine in this week's course. So, in this lecture, which is lecture number 11, I have included medical pluralism, conceptual understanding, and then focusing on biomedicine. And the concepts that I have covered here is definition of medical pluralism, then biomedicine and germ theory, then biomedicine and pluralism, then curative medicine and preventive medicine. Now, let's begin with defining medical pluralism. Pluralism is a term that you are familiar with. Pluralism is a concept that has been used in many different ways, most notably in relation to social and cultural phenomena. In contrast to monoism or unity, the term acknowledges multiplicity and differences and that there are different ways of knowing and being. So, pluralism simply talks about existence of multiple things together. Although there may be differences, but that existence of those things together is very important. Now, pluralism within medical domain is also being examined by sociologists and anthropologists. According to Gabe, Bury and Elson, medical anthropologists were the first to use the concept of medical pluralism. Medical pluralism refers to the coexistence of differing medical traditions grounded in different principles or based on different worldviews. Now, you may have this question that why did anthropologists identify this medical pluralism? Because anthropologists were primarily focusing to understand the various ethnic communities, right? And every ethnic community within its own culture has some kind of practices which are related to the health seeking behavior, and they have also identified some sort of medicine, no matter what type of medicine that could be or would be. So, sometimes that could be the herbal medicine or sometimes related to something else. So, this way the medical anthropologist had huge data on the diversities existing within the medical practices, and so they basically formulated this concept of medical pluralism. Now, that is increasingly used not only in social sciences but also in other systems of medicine. Now, Bhasin says that medical pluralism may be defined as the synchronic existence of more than one medicine system grounded in different principles or based on different worldviews. So, one specific system of medicine should get identified by a specific system of principles or worldviews. So, that way we will differentiate one system of medicine from other system of medicine. The allopathic or modern Western medicine, which is also known as biomedicine, is widespread and more widely accepted than other forms of medicine, which are also identified as traditional or indigenous, as we talked at the beginning of this lecture. Now, traditional medicine may include different systems of medicine. We have Ayurveda or Siddha or homeopathy, all popular traditional medicines in Indian context, and then there are specific terms like complementary and alternative medicine, CAM. Some of these have been defined by World Health Organization also, but we'll talk about the traditional medicine in forthcoming lectures, and in today's lecture we will focus on the biomedicine, because there are diversities existing within the biomedicine. So this much of discussion was necessary to understand the medical pluralism. And then we also are familiar with the concepts like folk medicine, home medicine, ethnic medicine, etc. That means there are different systems of medicine, and all these system of medicine basically create a specific kind of health behavior, and the health behavior of people are changing because of multiple reasons, not only because of the medicine, but because of the kind of changes which are taking place within the larger society. So, in this week's course, we will talk about the health behavior of people and how or what kind of changes are occurring within that also, and what are the factors which are causing those changes. So, this much of introduction of the theme of this week is, I think, enough. We are trying to understand medical pluralism and health behavior. Now, biomedicine and germ theory. When we were talking about the biomedical perspective, we referred to the biomedical perspective and somehow the terms like biomedicine and germ theory very briefly. Now we will have an extended discussion on these things. We have stated in earlier lectures that the scientific inventions that took place in Europe between 16th and 19th century caused the emergence of biomedical approach in the 20th century. And it helped in emergence of the germ theory of disease and biomedicine, right? That we discussed earlier. Now, there is something important, that is why I have included this point here. Because simultaneously, in Europe itself, there was a growth of a parallel system which is known as public health. With the greater urbanization and industrialization caused by the Industrial Revolution came widespread disease. We know that in 19th century, mid of the 19th century, Europe has witnessed several epidemics, right? And there were massive diseases occurring there, which were also identified as the product of the capitalist mode of production by the Marxist sociologists, you may remember, right? But basically, the fact is this, that the Europe has witnessed the growth of multiple disease and epidemics in the mid of the 19th century. And just to address the problems caused because of the spread of those diseases, there was a kind of coherent type of action which took place in Europe, primarily England, in few other countries, and those basically activities or acts were collectively identified as public health movement at that point of time. Now, this public health developed not only in Europe but also in USA, but basically there were several other important things which were happening simultaneously. The key tenet of public health theory was that health and disease arise from relationship of individuals and populations with their natural or manufactured environment. So the key argument in the public health theory was this, that when people interact with the environment, now the environment may be the natural environment or the manufactured environment. That means we are talking about the industry, industrialization, urbanization, etc. Those are basically the manufactured environment. So because of that kind of interaction, there are several ailments or diseases which come into existence, and for curing or stopping those occurrences, there is a need of some kind of intervention or modification in the environment itself, which is somehow responsible for causation of the problem. So, this is the core argument of the growth of public health. But public health as of now has become a very broader concept. It has become multidisciplinary, and it has become a kind of meeting point between the social sciences and medical sciences, and of course the biological sciences also. So, we have included public health as a separate topic that we will discuss in the forthcoming lecture. So now, as of now, although biomedical perspective or biomedical approach was responsible for growth of biomedicine on the one hand, and to some extent influenced the growth of public health on the other hand, but public health became a separate or major discipline or sub-discipline, and we are not talking about public health at length here. But we are talking about the biomedicine which is related to germ theory. In the late 19th century, it was suggested that the disease was caused by bacteria and that a specific microorganism would be present in every case of a particular disease. And this approach was known as the germ theory of disease, that there is a germ which is responsible for causation of the disease. The germ theory of disease provides the basic ground of growth of biomedicine. Now, biomedicine, as stated earlier, also referred as Western medicine, mainstream medicine, or conventional medicine, is a branch of medical science that applies biological and physiological principles to the clinical practices and getting guided by biomedical approach. Biomedicine talks about a standardized evidence-based treatment. Now we are trying to understand comprehensively what this biomedicine is, because this is influencing our life in a multiple way in our day-to-day functioning. Biomedicine talks about a standardized evidence-based treatment. You might have heard the term evidence-based treatment. That means there should be scientific evidence for the causation or for the cure kind of thing. It will happen only on the basis of certain evidences. Now, it will not happen on the basis of only some kind of postulates or perception or some kind of myth or some kind of imaginary kind of relationship. No, it will not take place on the basis of those things. It will take place on the basis of evidence-based treatment. And standardized. Standardized means that there should be certain benchmarks which should be fulfilled, or there should be certain criteria which should be fulfilled, right? With treatment administered via formally trained doctors, nurses, and other such licensed practitioners. So within this biomedicine, there will be certain professionals who will provide the treatment, but these professionals should be licensed practitioners. That means they should fulfill certain formal conditions which are necessary for that. With the rise of biomedicine came greater knowledge about the causes of infectious disease. Now we will talk about the kind of understanding which developed to fight the infectious disease, primarily which was guided by the biomedicine and the germ theory. The term biomedicine first surfaced in the 12th edition of Dorland's Medical Dictionary, but its career took off in 1950s. That means the term was used way back in 1923, but the term became popular in 1950s, as we have referred several times. Germ theory was derived from 19th century microscopic research by Louis Pasteur and Robert Koch, among others. Pasteur demonstrated the existence of microorganisms which could be killed by sterilization or made to multiply rapidly in suitable media. Koch succeeded in isolating the anthrax bacillus, growing it in culture, and proving by experiment that its spores could reproduce rapidly even after a long delay when conditions become favorable. So here a term culture is used. So don't confuse this culture with the concept of culture that we are talking about. This culture is basically used in a medical sense, and you may be aware of the fact that sometimes some pathological tests are conducted and those are identified as culture. For example, urine culture you may be familiar with. So this culture is a medical term used here and not a sociological term, right? This provided the principles that the microorganism should be able to be grown outside its host. But if the disease is getting caused because of the presence of a microorganism, then that microorganism can be identified and it can be grown also outside the host. And when it can be grown outside the host, then it can be used for the cure of that particular treatment. Now, this is a very important scientific understanding which developed. And then should still be capable of producing the disease again in the host body. So basically how this antibacteria or antibiotics basically is operating, for that basically these statements have been mentioned over here, that a particular bacteria can be extracted from the host, it can be developed further, and then it can be reused. The more formal experiments on the relationship between germ and disease were conducted by Louis Pasteur within the years 1860s and 1864. Robert Koch is known for developing four basic criteria known as Koch's postulate for demonstrating in a scientifically sound manner that a disease is caused by a particular organism. As one of the main founders of modern bacteriology, he identified the specific causative agent of tuberculosis, cholera, and anthrax, and also gave experimental support for the concept of infectious disease. So, when we talk about infectious disease, even in contemporary context, we do identify problems like tuberculosis and cholera. Cholera was a very lethal pandemic kind of disease, and fortunately the modern medical science has helped to control the spread of cholera. So basically with the invention of this germ theory of disease and biomedicine, this fight against these type of infectious disease could be won. Now we talk about the next important part of our lecture, and that is basically related to the pluralism within the biomedicine, because we are talking about medical pluralism, and we have stated that within every system of medicine there are some kind of diversities and differentiation that is basically identified as pluralism. So within the biomedicine there are a number of other streams emerging or already emerged, and that can be identified as pluralism. Modern biomedicine is notably secular, indifferent to ideas of the supernatural or the spirit, and concentrates on the body and society to determine cause and cures. Now, why did we say here that modern biomedicine is secular? Because prior to the 19th century scientific understanding, diseases were considered as divine curses, right? So, from the ancient to the medieval period, disease was considered as supposed to be a divine curse, and so the term secular is used, that was free from any religious belief. Modern medicine approaches healthcare from two angles. The first, the medical model, focuses on the eradication of illness through diagnosis and effective treatment. And the second, the social model, focuses on changes in society and in people's own lifestyle to make the population healthier. That is the influence of the PHM, that is the public health movement. Now that is why we talked about the public health movement, because within biomedicine actually an important stream developed that acknowledged the impact of the external environment, or for that matter which talked about the social model, right? So we have been talking about the social model and the public health approach also, although we have not made a detailed discussion on that, and we will certainly undertake that detailed discussion. But as of now, you may understand that within biomedicine, basically these two approaches developed. Now, what are these two main approaches? One is known as curative medicine and the second one is known as preventive medicine. So preventive medicine is a term that became very popular during COVID also. Now we will try to understand both. What is curative medicine? Curative medicine aims at removing disease from patients. Curative medicine involves treatment by administering antibacterial and antibiotic drugs, which produce, drugs here means medicines, which produce a reaction that neutralizes the disease, and few other interventions depending upon the specialization and the problems and symptoms identified. So basically curative medicine is that kind of approach where the ultimate purpose is to have a cure, right, by applying certain antibacterial and antibiotic medicines and certain other things, right. The purpose is to get the body cured, get the person cured from the ailment which is existing. Curative medicine is as old as medicine itself. Now again, in some of the previous lectures we stated that basically the effort of developing the medical approach started long back from the times of Hippocrates. right? So this is having a long history. However, it matured in 20th century. So it acquired unprecedented scientific knowledge about disease, medicine, and ways of administering the medicine. That means curative medicine as an institution developed primarily in the 20th century because of the developments we just mentioned. As a result of this specialization, surgery, radiology, and anesthesia developed, which are based on skills. So we are all familiar with the kind of terms that we have just used. Surgery is often taking place, or for that matter, some kind of radiology. When we talk about X-ray, etc., that is related to radiology. And anesthesia, when we make people unconscious or semi-conscious during a surgery, then that for that basically anesthesia is used, and there are different types of anesthesia. We are not interested in talking about these specialization as such, but we want to understand the diversification which was taking place within that. Then the major specializations basically took place within biomedicine, and there are few terms that I have mentioned here, and you would be familiar with all these terms because of your own exposure to the healthcare system, like general medicine, then general surgery, pediatrics, obstetrics, gynecology, dermatology, ophthalmology, orthopedics, ENT, that refers to ear, nose and throat, then psychiatry, and several other things. There is also super specializations which require further 3-5 years of study in areas such as plastic surgery, neurosurgery, cardiothoracic surgery, etc. That means there are good number of specialization and super specialization developing within this curative medicine. Then there are different structures and format in which this curative medicine is provided to the needful in different parts of the world. Now, what are the healthcare systems for providing these curative medicines? So we get to know that the healthcare system is developing as per the political economy or the administrative structure of that particular society. So sometimes we have the government controlled healthcare centers, sometimes we have the private healthcare centers, sometimes we have a combination of the government as well as private, which is a case of India. Then we have some sort of cooperatives or the community based centers. Then in India, we have a different type of structures like primary care, secondary care, tertiary care, then a referral system, then a specialization and super specialization. And then all these things actually increase the diversification or the pluralism within this existing system of medicine. And then we come to the preventive medicine, which is also the last topic in today's lecture. Preventive medicine, by definition, preventive medicine is applied to health of persons in groups. That is, it focuses on population rather than individual. Now, this is very important basically. When we talk about preventive medicine, so this is generally applicable for the communicable disease generally, because it can be used for the non-communicable disease also at some level, but at a larger level, this is used for in case of the communicable disease. And so the population as such is the target, right? And if one person is getting infected, then other people will come in touch with that individual, and then most of the people will get infected by that problem. So preventive medicine talks about the larger population. Primary objective of preventive medicine is the prevention of disease and promotion of health. Now, there are two important components. One, prevention from the occurrence or the exposure to the agent of causation of disease, and second is the promotion of health, that the health of the individuals should be promoted to the level that even if he or she is getting exposed to the infection, he or she should not get infected. Again, COVID is a good example of this type of situation, because we all went for vaccination. Now, that was the sure way of preventing ourselves from the infection which could have been caused by COVID, right? Preventive medicines have helped us in decreasing the rate of morbidity and mortality caused from diphtheria, tetanus, typhoid, fever and other diseases. And we all know that during the childhood, early childhood and late childhood, the children are basically given several vaccinations for prevention from the occurrence of all these diseases. So this is very important. Then in the field of nutrition, preventive medicine has played a very important role because there are several types of ailments or problems which is caused because of the nutritional deficiency. And so to address that nutritional deficiency, there is a provision of making some kind of additional or supplementary supply of nutrients. Like if a disease is getting caused because of iodine deficiency, then people who may get affected because of that are given the additional supply of iodine, right? And discovery of vitamins, minerals, proteins and other nutritional requirement of a healthy body has prevented the attack of many diseases. Now, recently I personally got to know about the importance of sodium and potassium in human body, right? So basically all the nutrients that we are aware of are very necessary, and the absence of that in different stages of our life basically creates severe problems. So this preventive medicine is actually very much important, and it takes care of the health needs of not only the individual but the population at large. Modern preventive medicine has been defined as the art and science of health promotion, disease prevention, disability limitation and rehabilitation. Now again, this is very important from the perspective of disability limitation, because we all were exposed to the circumstances in which, because of deficiency of certain nutritional components, some kind of disability was getting caused. Blindness is one of that kind of basically limitation or disability. So this preventive medicine operates at three levels. The primary level, it aims at keeping people healthy and immune from disease. So immunity is the goal. At secondary level, it treats those who are suffering from their disease. But despite that immunity, or because of low immunity, if some people are getting infected by the problem, then some kind of treatment is what is prescribed at this level. And at the tertiary level, it tries to lower the impact of the disease on those who have it, and then mitigating the impact of the disease. That is also a very important threshold kind of thing. So these are the three levels at which the preventive medicine is basically addressed as of now. So with this, we come to the concluding part of this lecture. These are some of the references that I have used. And as I stated earlier, this is literally complex in the sense that there are so many parallel developments. So you might get exposed to some other understanding or some other facts which you may not find directly sync with the kind of things we have discussed. But in that situation, you need to understand the things at length. Go try to find more about that and try to study some of these books. You will get the deeper insight, and then everything will appear connected to each other, right? So before we close, there is one question for your think about this problem, and another question for your activity question. So you read and try to answer this question. So thank you very much. Take care. We will meet in the next lecture of the third week course.